Welcome to OSS and our Total Joint Program. The purpose of our program is to provide you with a comprehensive look into why joint replacement surgery was recommended, as well as the tools necessary to prepare you for a positive experience. The hip joint anatomy consists of the pelvis, the socket or the acetabulum, the head or ball of the femur, which is your thigh bone, the neck, and the articular cartilage. Hip replacement surgery consists of the ball being replaced, the socket resurfaced, and rough cartilage and bone spurs are removed. Metal and plastic are used to restore the smooth surfaces. This is what your new hip replacement would look like on X-ray. The bright white parts are the metal components. The plastic parts are clear, so they are not apparent on the X-ray. The knee joint anatomy consists of the bones of the femur or the thigh bone, the tibia or your lower leg bone, and the patella, which is your kneecap. Articular cartilage is a Teflon coating on the ends of the bones and also lines the back of your patella, the meniscus, which are medial and lateral, and the ligaments. Knee replacement surgery consists of replacing the cartilage on the femur, thigh bone, the tibia or shin bone, and sometimes the patella. Metal components cover the bone, separated by a plastic spacer. This is what your new knee replacement looks like on X-ray. The bright white parts are the metal components, and the clear space in between the upper and lower leg is the plastic spacer. Preparing you for surgery. Your surgeon may request that you have a preoperative evaluation by a medical physician prior to your surgery, otherwise known as a medical clearance. Your medical physician and surgeon will be working together to ensure you have the best care during and after your surgery. The reason for a medical evaluation is to assess all of your current medical problems and determine how to best manage these problems during and after your surgery. Preoperative assessment. This is important for the medical physician to consider the medications you are currently taking and to make recommendations for continuing or discontinuing those medications during the surgical period. The medical physician will consider your past medical history, including respiratory and cardiac issues. This medical history will determine if further testing may be necessary prior to your surgery. Preoperative surgical testing. This consists of obtaining required pre-admission testing such as blood tests, EKG, urine sample, and possibly a chest X-ray. Your physician may request a cardiac clearance by your cardiologist if necessary. Bring a list of current medications with dosages, including the milligrams and the times of day that you take these medications. A list of physicians you see regularly, a list of all of your allergies, including medical and non-medical, a list of your medical and surgical history, and all patients must be tested for MRSA and MSSA. Surgical site infection prevention. MRSA and MSA are, MRSA is methicillin-resistant Staph aureus, and MSSA is methicillin-sensitive Staph aureus. It is resistive to the usual antibiotics, where the MSSA is sensitive to the usual antibiotics. Patients who are found to be positive for either of these will receive the following: a phone call notifying you of the positive result. A prescription will be faxed to your pharmacy for mupirocin, which is an antibiotic ointment to apply to both nostrils and underneath all of your fingernails for the 5 days prior to your surgery and also the morning of your surgery. You'll be instructed to refer to the form titled Preoperative Preparation Form for the MRSA and MSSA colonized patients. This form must be completed and brought with you the morning of your surgery to the hospital. Medications to stop taking. 2 weeks prior to your surgery, we would like you to stop herbal medications consisting of fish oil, glucosamine, garlic, ginseng, vitamin E, and also multivitamins. These can thin your blood, and we don't want your blood too thin prior to surgery. 1 week prior to your surgery, we like to stop blood thinner therapy. OSS will contact your prescribing physician and notify you when to stop. NSAIDs are nonsteroidal anti-inflammatory medications, and these consist of Advil, Aleve, ibuprofen, Mobic, and diclofenac. Ask your doctor if you're taking hormones or birth control medications, as these need to be stopped prior to surgery with approval from your physician, and if you are taking any immunosuppressant medications, which would be prescribed by a rheumatologist, you may need to stop taking them 14 days prior to surgery. Medicated patches. If you are currently using a prescription patch for any reason, such as pain management, control of your blood pressure, or estrogen replacement, please bring a copy of the prescription with you the day of your surgery, and also the container that you keep this medication in, the prescription box. If you do not bring a copy of the prescription and the container with you the day of surgery, we are unable to verify the medication on the patch, and we will need to remove it and replace it with one of our own to ensure your safety. Other important factors are nutrition. We would like you to eat balanced meals to maintain or lose weight. Continue to monitor blood sugar if you are a diabetic. Physical therapy. There are regular exercises in your total joint packet to start practicing regularly to increase your muscle strength, and also the use of tobacco if you can. There are risks associated with this with anesthesia. It can cause post-operative respiratory complications, and it delays wound healing.
Preparing for your hospital stay. This is a picture of our beautiful OSS Orthopaedic Hospital. Some items to bring with you at your stay at the hospital. First, rubber-soled, non-skid shoes or closed-back slippers. This is to prevent you from slipping at your stay in the hospital on your surgical leg. Dentures, hearing aids, and/or glasses. Please bring the containers to hold these so they don't get lost. You may want to bring loose-fitting clothes for therapy. We recommend shorts, sweatpants, t-shirts. A list of the current medications, including the dosages and times they are taken, but not the actual medications. This will help the pharmacist with maintaining your medication control. Bring all your insurance cards and picture identification. You may want to bring a copy of your living will, durable power of attorney, and organ donor, if you have it. You also want to bring your total joint folder or packet. This will help you to reference it during your stay at the OSS hospital. If you have sleep apnea and use a CPAP device, you would want to bring that as well. The items you want to leave behind. You want to leave behind your personal medications. The pharmacy will maintain any medications you're currently prescribed. A walker, cane, or wheelchair, if you own one, you may bring it with you, but please keep it in your vehicle until the nurse or the therapist will instruct you to bring it into the facility. If you have large amounts of cash, credit cards, valuables, and jewelries, do not bring them, since we do not provide a safe in our hospital rooms. The day before your surgery, please do not shave your legs on the day of surgery or the day before. This prevents any incisions or accidental cuts that may lead to infection. You're going to use the antibacterial soap provided by OSS 4 days prior to surgery and the morning of your surgery. Remember, do not eat after midnight or drink. That includes candy, chewing gum, or throat lozenges. Please follow the physician instructions for drinking fluids as noted in your pre-procedure instruction sheet located in your packet. You will be called by the hospital the night before your surgery with your exact arrival time. And remember, no smoking after midnight. This does include smokeless tobacco. The day of surgery. On the morning of surgery, make sure to take the certain medications with a small sip of water as instructed by your doctor. You will use the antibacterial soap provided by OSS on the morning of your surgery. Arrival at the facility. You will need someone to drive you. If you enter at OSS Hospital, you would stop at the reception desk immediately to your left. At Memorial Hospital, you would report to the second floor. For York Hospital, you will report to the short stay unit, which is taking the south elevators to the second floor. This is a picture of our OSS hospital reception desk. Check-in and preoperative procedure. The hospital staff will check you in and have you sign some additional paperwork. You will be asked to change into a hospital gown, and the nurse will start an IV. You may be asked additional questions by the nurse, anesthesiologist, and/or your surgeon. The surgeon will initial your leg to indicate the correct surgical site. Anesthesia. The following options are available and will be discussed with yourself, the surgeon, and the anesthesiologist. The options include general anesthesia, which is the inserting of a tube into the airway and respiration is monitored. This is the maximum sedation. Spinal anesthesia, that is the inserting of a spinal needle into the spinal column, numbing the entire lower extremity. An epidural is similar to spinal anesthesia, but a catheter remains in the spine in order to maintain pain control. Peripheral nerve blocks. This is used in conjunction with the other anesthesias, which is the numbing of one nerve in one part of the leg. You'll be brought into the operating room on a gurney. Your identification will be checked, and you may be asked what surgery you are having. This is to ensure that we have the correct patient. You will be positioned on the operating table, and the anesthesiologist will proceed with the induction of anesthesia. You won't remember much after that. The actual surgery time is approximately 1 to 3 hours. During the surgery, your family will wait in the OR waiting room. The surgeon will come out to speak with family members once the surgery is completed. For information regarding family visitation and what to expect after surgery, please refer to the What to Expect information located in your surgical packet. The PACU, or Post-Anesthesia Care Unit. After surgery, you will be transferred, and a different set of nurses will assess and treat your pain and care for you as you recover from the anesthesia. You can expect to be in the recovery room for 1 to 3 hours. Once you're stable, you will be transferred to the nursing floor where your family will be able to see you. Here's a picture of our OSS Hospital PACU. Postoperative pain relief options after surgery include the epidural anesthesia, which we discussed in the previous slide, patient-controlled analgesical pump, or the PCA pump, which is controlled by you, the patient, but monitored by your doctor's instructions. There's also injections that can be administered into the muscle, or there's oral pain medication. Based on your physician preference, you may have a urinary catheter to drain your bladder. This is typically removed within the first 24 hours to prevent infection. There's a drain to keep excess fluid away from your new joint, the PCA pump, or a pump for pain medication, a continual passive motion machine, commonly known as the CPM, for total knee patients only, a knee brace or knee immobilizer, or for a total hip replacement, a hip abduction pillow.
First day after surgery. This is a picture of what your hospital room will look like at our hospital. First day after surgery, we're going to advance your diet as tolerated. You may experience some nausea or vomiting after surgery, so we like to start things slow with ice chips and then clear liquids. Eventually you'll be on a regular diet once you're feeling up to it. A therapist will work with you and may encourage you to walk. A social worker or case manager will talk with you about discharge planning options. You will have blood drawn for lab work. You will be encouraged to breathe deeply and cough frequently to prevent fluid accumulation in your lungs. Pain management. You will experience pain and discomfort after surgery. You're having major surgery and it's not uncommon to have discomfort. We will try to keep you as comfortable as we can. We usually rate your pain scale from 0 to 10, 0 being no pain, 10 being severe pain. Please be honest with your pain level. We want to keep you comfortable. The nurses will give you medications accordingly. Request pain medicine prior to your therapy, usually about 30 minutes before your therapy session. We encourage you to have a pain pill. That way when you have your therapy session, you're more comfortable and you'll get a little bit more out of the session. The important thing is to remember not to wait to take your pain medication. You don't want to wait and let your pain get ahead of you. You want to pre-medicate so you do well with your therapy. Second day after surgery and moving onward. Therapy will begin the morning of your first post-operative day. If your surgery is earlier in the day, you may have surgery your first post-op day. Nursing assistants and nurses are available to get you up. Please do not try to get out of bed by yourself. You need to make sure someone is with you. You could be lightheaded from surgery, from pain medications. It's very important to us that no one falls. Therapists are going to form a treatment plan for you, which would include your activities of daily living, instructing you how to get in and out of bed and to walk with your walker or crutches. Continuing clinical care, you will have blood work drawn while you're in our hospital daily. We will continue pain management. We will give you some instructions on bedside education as far as your blood thinners and anticoagulants. Preventing post-op complications. Please call your doctor if you experience increased pain, increased swelling, and this would be a change from the day before. If you're having pain, that's normal. If your pain is now increased to an intolerable level, even with your pain medicine, that would be a change. We would want you to give us a call. If you're having chest pain or shortness of breath, please call 911. That is more of an emergency situation. Do not call the office. If you're having tenderness in your calf or thigh of your affected operative leg, swelling, redness, warm to touch of your operative leg, please call us. We may want to get an ultrasound to check for blood clot. If you're having a continuous daily fever of 101 or higher, it's not uncommon to run a fever of 99 or 100 after surgery, but if it's 101 or higher, that could be the sign of an infection starting, so please call the office. We may want to have you come in and be seen. Preventing postoperative complications. Constipation can be a post-op complication. We encourage a daily stool softener, laxatives as needed, increase your fluid intake. It's normal to be constipated after surgery. You've had anesthesia and you're taking pain medications, which can all lead to constipation. Nausea. If you experience nausea after surgery, we'll advance your diet as tolerated. We can also give you some anti-nausea medications as needed. Swelling, to help keep swelling down, we'll put ice, use cold therapy, elevation of your operative leg. Pneumonia could be another post-op complication. To help prevent pneumonia in the post-op period, we'll have you breathe into an incentive spirometer, coughing, deep breathing, and early mobilization. The sooner you get up and move, the more you expand your lungs. That will help prevent pneumonia. Infection, we'll have you keep your surgical site clean and covered with a dry bandage. We will give you IV antibiotics for the first 24 hours after surgery. Hand washing for you, your family, anyone visiting, caregivers is also important to help prevent infection. Blood clots are another possible post-op complication. You will be treated with some form of a blood thinner. There are several. Lovenox, Coumadin, aspirin, or Xarelto are some of the choices. We also will fit you with TED stockings, which are tight anti-embolism stockings to help keep the swelling down. The less pressure on your veins, the less risk of a blood clot. You will have sequential compression devices on your calf while you're in the hospital. This is a machine that will inflate and deflate and keep the blood from pooling in the calves of your legs. Early mobilization is also indicated for prevention of blood clots. Lovenox is a blood thinner that may be prescribed by your surgeon in the post-op period. Lovenox is an injectable medication that is injected into the fat pad of your abdomen. They come pre-drawn syringes. You don't have to draw any medications up, and it's injected directly into your stomach. You just wipe the area with an alcohol pad and you go directly in. Very similar to an insulin syringe if you're diabetic. Coumadin is another form of blood thinning agent your doctor may prescribe in the post-op period. Coumadin is monitored with weekly blood work. You have to have your blood in a specific range for Coumadin to be effective. We generally recommend you take the medication at the same time every day to keep a continuity level in your blood. We don't want you too thin and we don't want you too thick. We want you to fall somewhere in the middle. Your dosing of Coumadin may change due to the fact your blood work will change daily. Your doctor's secretary will contact you as to what dose of Coumadin you should take for that week. There is a contraindication with Coumadin. You do not want to eat foods high in vitamin K while you're on Coumadin. That would be green leafy vegetables such as spinach, kale. Vitamin K is the antidote to Coumadin, so if you're eating a lot of those foods, they're going to make your blood clot, and we would like you a little thinner. Xarelto is another blood thinning agent your surgeon may prescribe for you. It is an oral medication similar to Lovenox, but it is in the pill form. The only contraindication with Xarelto is if you have a severe milk allergy, you should not take Xarelto. There are some precautions we would like you to follow while you're on the blood thinning agents. Bleeding of gums while you brush your teeth, you may want to use a soft toothbrush. If you notice blood in your stool or urine, you would need to contact our office. We recommend you shave with an electric razor versus a straight razor because of nicking your skin. A small cut could not stop bleeding while you're on the blood thinning agents. And if you're still menstruating, you may have heavier periods than normal. Precautions after going home. Inform all your healthcare providers that you have had joint replacement surgery. Notify dentist if you're having a dental cleaning. We do have you pre-medicate with antibiotics prior to dental cleaning. This is just to help prevent any secondary source of infection. Dental cleanings are very dirty. We have a lot of bacteria in our mouths. If your gums bleed, that could potentially attack your total joint. You will be given an identification card to carry in your wallet that states you have had joint replacement surgery. Precautions after going home. Inform all your healthcare providers that you have had joint replacement surgery. Notify your dentist that you have had a total hip or total knee replacement. You will need to take an antibiotic before any dental work or cleanings can be done. There is a chance that you could have a secondary infection from an outside source. Dental cleanings are the most common. You have bacteria in your mouth, we're cleaning your gums could bleed, bacteria could potentially enter your bloodstream and attack your total joint. Most dentists will prescribe an antibiotic to take prior to your procedure or cleaning. You will be given an identification card that indicates you've had joint replacement surgery. On the back of that card are listed all the procedures you would need to be pre-medicated with. If the surgeon or dentist doing your procedure is not willing to prescribe those antibiotics, please contact your surgeon's office and we'll be happy to prescribe those for you.
A majority of our patients do end up going directly home from our hospital. When you do go home, we do make arrangements for a nurse and a physical therapist to come and visit your home. We will talk with you about options that are available to you for different home health agencies. If you refer to your joint binder, there is a list of home health agencies that are located in your area. If it's indicated by your care team that you need continued physical therapy in an inpatient setting, we may recommend that you consider going to a nursing home for rehabilitation or to an acute care rehab hospital. These options are also located in your joint binder, and we ask for you to refer to that ahead of time. Please take a look at your options and know what you might consider should you need further rehabilitation. Please also know that your options are limited by your insurance plan. You want to expect to stay with us anywhere from about 2 to 3 days, and this would also include the day of surgery. You will be seen by a social worker or a case manager to finalize your discharge plans. We will help make arrangements for your medical equipment or your continued physical therapy. In helping to determine your discharge destination, we will assess your ability to walk and participate in activities of daily living, which would include dressing, toileting, and meal preparation, and this will help to determine your discharge destination. On the day that you are discharged from our hospital, we do want you to be aware that there are several factors that go into organizing your discharge from our facility. First and foremost, you will need to be seen by your doctor to determine that you are medically and orthopedically stable for discharge. You may need 1 or 2 more physical therapy sessions. And of course, as with anything, there's always paperwork. We will go over with you your discharge instructions, and that can be determined at the time whether or not you would like to have a family member present when those instructions are given. The other piece of information that will be included in your surgical binder is some information about advance directives and living wills. We ask you to take the opportunity to look over this form and decide whether or not this is something you would like to complete before you come to our hospital. If you have already completed your advance directive or living will, wonderful job. We just ask you to bring that the day that you have surgery. If you would like assistance in completing the advance directive and living will that's located in your binder, we will be happy to help you. If you need the forms to complete, we have them here for you to take home. We do ask that you take the opportunity to know your insurance copays. Many insurance companies do require a copay for home health, physical therapy, or nursing visits. Please also, in your surgical binder, review the list for home health agencies, acute rehab hospitals, and extended care facilities. We also ask that you please take your prescription for your blood thinning medication to your pharmacy. Please leave it at the pharmacy until after your surgery. We also ask that you take a moment and complete your advance directives and bring that with you the day that you have surgery. Should you need more information, please refer to the Medicare.gov website.
Make modifications to your home prior to surgery that will decrease your risk for falls or injury. Before coming to our hospital, you want to make sure that you're moving electrical and phone cords away from your walkways. You want to make sure that you have chairs that have armrests and avoid any low chairs or sofas. Please remove any throw rugs that may cause injury. For your stairways, you want to replace worn stair treads, install stable handrails on both sides of the stairs, and you want to make sure that your stairs and hallways are brightly lit. In your bathroom, you may wish to install grab bars in the bathtub, install skid-resistant strips or rubber mats in the bathtub, and you may want to have a raised toilet seat or a tub transfer bench on hand. In your bedroom, you want to make sure that you have a lamp and a phone within reach. You want to keep a clear path from your bedroom to the bathroom, and you always want to sit while getting dressed. In your kitchen, you want to store frequently used items at waist level and less frequently used items in the higher cabinets. It may also be helpful to prepare and freeze meals prior to your admission to the hospital. In physical therapy, we will instruct you on walking, climbing stairs, strengthening exercises, and range of motion activities. You will be expected to attend physical therapy 2 times a day as tolerated. You may have therapy on your day of discharge as well as on your day of surgery. Any post-operative hip precautions would be to avoid crossing your legs at the knees or ankles, and your surgical leg should not cross midline. You want to avoid bending over to pick objects up off the floor, and you want to avoid bending more than 90 degrees at the hip. You want to avoid any twisting or pivoting and not to rotate your foot inwards. For post-operative knee precautions, you want to avoid kneeling for the time being, and do not place a pillow under your knee so that it remains flexed. Equipment frequently used in physical therapy would be abductor wedges or pillows to prevent the legs from crossing the midline while you're in bed, and for total knee replacement patients, we do use continuous passive range of motion machines that will aid in knee mobility. Some physicians are currently using the machines and others are not. You may also be issued a knee immobilizer for bedtime use only. We do use walkers and crutches for walking assistance. If you do not have one, we will assist you in providing one. Thank you for participating in our joint replacement education. If you have any further questions, please contact your surgeon's office.